Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's now understand a bit of pharmacology, that is starting with the tocolytics. So these tocolytics, the drugs, they are classified as, firstly we look at CCBs. CCB is nothing but the calcium channel blockers. So calcium channel blockers commonly used ones are the nifedipine. So they all end with dipines. So first is the nifedipine, then comes the nicardipine, then comes the verapamil. So these are the commonly used CCBs. Next comes the competitive inhibition to the calcium ion. So you have the competitive inhibition, and this competitive inhibition is to the calcium ion. So the examples here being the magnesium sulfate. Next comes the cyclooxygenase inhibitors. So what happens in the cyclooxygenase inhibitors? It is the indomethacin and the sulindac. So it is the indomethacin and the sulindac. Next, moving on to the beta mimetics. So under the beta mimetics, what is included? Under beta mimetics, it includes the terbutalin. Next comes the ritodrine, as well as the isoxpurin. Next, moving on to the oxytocin antagonist. So this includes the atoxiban. Next comes the nitric oxide donors. So under nitric oxide donors, this includes the glyceryl trinitrate. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.